This is Dr. Christy DeSapri, founding physician of Bone and Body Women's Health. Today I wanted to talk about hormone levels, estrogen levels, progesterone levels, testosterone levels, and all of these things that are being brought up in the media, in the commercial space, as well as in my office with my patients. So the most important thing to remember when we're talking about hormone levels is these can be checked in many ways: in the blood or serum, in the saliva, and in the urine, called the Dutch urinary testing. The first and foremost thing that I want you to know is that we don't define menopause based on hormone levels. We define perimenopause, menopause, and how we decide to evaluate and treat women with these symptoms is based on their symptoms, not based on a blood test, a saliva spit test, or what they show in their urine. So it's really important to understand that despite testing that might be on the market, or you might be getting something, advertisements to get testing in your urine or saliva, or be offered some of these testings, remember that the most important thing is, before what the test is, what are your symptoms? What are your symptoms that are seeking you to obtain these testings? Are you missing your periods? Are you having hot flashes? Are you having heavy bleeding? Are you having insomnia? Are you having other perimenopausal symptoms that maybe someone's not talked to you about? It's more important to know what your symptoms are, how we can evaluate and treat those symptoms, rather than understanding what is in the blood, serum, or urine. So when I see patients, that's the first and foremost thing I talk about. What are the symptoms, whether you're in perimenopause or menopause? Then we decide if we need to obtain blood testing, serum testing for estrogen, progestogens, or testosterone, and we decide on that if we are also going to be replacing those hormones and if we need to follow along those blood levels. I know it's a little confusing because our definitions of menopause can be 12 months without a period, but the reality is 70 to 80% of women have symptoms before that time, and the perimenopause and menopause transition is a time where we should treat you based on your symptoms, not just based on your blood tests. I hope to see you soon.